Hello, everyone. So, autism is something where we have to identify it as early as possible. And most important thing is approach to a professional as soon as we find any concerns as a parent. Okay. Concerns in terms of milestones and the way the child is developing. Now, the thing is that many of the parents hesitate to visit for the first time to any professional. बिकॉज दे आर इन डाउट कि मैंने जाना चाहिए भी या मैं कुछ ज्यादा ही सोच रही हूँ अपने बच्चे के बारे में जाऊंगी और वहां पे कुछ नहीं निकला तो व्हाट विल द पर्सन और द प्रोफेशनल थिंक अरे कुछ नहीं है क्या माँ है इतना ओवर इन्वॉल्व है राइट सो मैं जाऊं या नहीं जाऊं या शायद ठीक हो जाएगा ना है ये या इतना नहीं है कुछ इट्स जस्ट प्रॉब्ली दैट आई एम इमेजिनिंग so there are so many things that usually parents might think even before they schedule a visit to a professional. But let me tell you, no questions asked, no explanations given. When in doubt, don't. If you are in doubt, don't step back. Go ahead and sort that doubt. Okay? So, irrespective of whatever your mind might be telling, or mind might tell 10 things to not go to a professional, silence your mind for that moment and just go with the purpose of getting clarified of your doubt, because anyways the doubt is going to eat you up inside as a parent, right? So might as well we schedule that appointment and go and get it clarified. So now when you go to a professional, remember one thing, that you need to tell your doubt the way you have felt it, the way you have experienced it. It could be small or it could be big, it doesn't matter. So it could be a simple doubt कि डॉक्टर मेरा बच्चा 1 साल का हो गया है लेकिन ये मम्मा डाडा नहीं बोलता है तो I am concerned. That might be just one doubt in your mind. Just tell that whatever you have felt and then leave the rest of the job to the professional to check if the doubt that has come in your mind is really going towards something or a really indicator of some major concern, or whether it is something that we can be comfortable with and let it go. So leave that part to the professional. What our job as a parent when we go there is to speak up our mind, whatever has come in our observation of the child, put it in simple words as you have noticed. That is the first part. Now, once you express your concerns about your child's development, the next thing that is going to happen usually is that the pediatrician, if you have visited a pediatrician, he will refer you to somebody who is expert in assessing or conducting assessments to confirm that our concerns are pointing towards autism or they are not. Once you reach to that person, let the person take charge of how he wants to assess and what he wants to assess. Okay, our job as a parent is just to be mindful of the questions and give as far as possible accurate data to the questions being asked. Yes, you will be asked questions. Usually there is a general talking which is done first to identify concerns. We call it as history taking. That will be done by the the professional, and you as a parent will have to answer. That might comprise of some questions that you might feel, is it even relevant to my concern? For example, the professional might just ask you कि past history क्या है, बच्चे का जन्म से लेके अब तक कुछ physical problems, health issues आए थे क्या? You might find why this question is being asked. It has nothing to do with the fact that my child is not smiling back or not responding to me. That is for you, but for that professional, all those questions make a lot of sense. They help them to connect the dots and identify the exact nature of problem. So you might feel that some questions are out of context or irrelevant, but trust me on that, most of the times all of these questions asked are asked on some purpose, and they are going to help us as a parent or your child to get a correct diagnosis. So even if that doubt comes to your mind, do not hesitate from answering it. Just focus on giving accurate answers. Another aspect is that there will be long set of questions that you might get asked. They might not just be 4 or 5 questions. So whenever you're going to get your child assessed to a professional, please take out good amount of time in your hand, maybe around 1 hour to be minimal on that front. 45 minutes to 1 hour is definitely what you must keep in mind that it might take. Why it is essential? Because you might also be taking child along with you. Whether the child will stay for 1 hour, will he get hungry, will he need water, all these things are to keep in mind. Get prepared on those lines also and go there. Otherwise, these small things become a major distraction for us to respond to the questions and for the professional to assess the child further. Okay. The second important part of all this is that when you get asked questions and suppose your child is actually having a developmental concern of much more magnitude than what you had thought of as a parent, there could be a lot of questions where your answers will start coming no. For example, बच्चा अपने आप से बैठता है, नहीं, उसको सपोर्ट लगता है, 9 महीने का हो गया तो भी उसको सपोर्ट लगता है, बच्चा 2 वर्ड्स बोल पाता है, 2 साल का हो गया है, नहीं बोल पाता है, बच्चा टाटा करता है, नहीं करता है, बच्चा आई टू आई कांटेक्ट देता है, नहीं करता है. What happens is when lot of questions that get asked to us as a parent, and when we realize that most of the answers are no, we might enter into a zone where we feel defeated, where we feel that, oh my God, my child doesn't do most of it. And you know what is a parental instinct? Parental instinct is not portraying our child in a negative way. My child should not come out in front of world in a negative way. And that parental instinct can throw us in a zone where then we start manipulating answers to the questions asked. You know, even in a normal case, remember going to a parent teachers meeting, what happens when teacher says कि आपका बच्चा ये नहीं कर पाता है अभी तक, उसको ये नहीं आता है, we become so defensive, right? नहीं नहीं, ऐसे तो वो कर लेता है लेकिन कभी कभार नहीं करता. And that is what our response can come even when we go to a professional कि बच्चा attention नहीं pay करता है क्या, नहीं नहीं वैसे तो करता है, कभी कभार नहीं करता. That is how we start manipulating, and then we may not be able to give accurate responses, which is of paramount importance for the professional to diagnose the child correctly. Okay. And why this is so important? Because remember, autism is one thing which cannot get diagnosed by any blood test. There are no brain scans to confirm the diagnosis. There are no such kind of blood tests to confirm the diagnosis. So if we want our child and his concerns to get accurately diagnosed, our responses should be free from our own parental instincts, which can make us manipulative or defensive subconsciously, again, not consciously. And we have to be free from our own biases too as a parent and give whatever is there in front of us. Sometimes it can happen that parents are working, the child is with grandparents or with a babysitter the entire day, and many times whatever questions are asked about the child's various functioning aspects, the parents might not know. In that case, as a parent, please say that you don't know and you would confirm it from somebody and then give the data. Don't feel ashamed ki, how can I say I don't know this about my child? No, it is perfectly fine. The professional there is not sitting to judge you. It is sitting to help you out. Okay. So if you want that he should help you out, you need to help yourself out of these small emotions that can come in our way of getting our child assessed correctly. Okay. Again, please remember that our image as a parent, our emotions as a parent need to be mindfully kept aside if we want to achieve larger purpose of getting diagnosed our child correctly and further helping him. So please take care of that.